Welcome to the third installation of the Basic LGBTQ Affirming Information for Therapists, presented by the Center on Colfax and facilitated by myself, Alexis Chavez. The goal of these informational sessions is to improve the clinical competence of therapists when they're working with LGBTQ populations. Before we can understand what it means to improve competence, we at least have to set down a basic definition of clinical competence that we can all agree upon. For the sake of this session, this is what we're going to call it: a combination of skills, knowledge, attitudes, values, and abilities that underpin effective and superior performance in a professional area. Clinical competence is more than being comfortable working with LGBTQ populations, and it's certainly more than being tolerant or being non-judgmental. Clinical competence is understanding some of the nuances and how to best treat this population with their unique needs. This presentation will mainly focus on competence building for working with transgender populations. And there's a few impetus for this. The first is that it's one of the subsets of the LGBTQ population that I hear people say again and again and again they just don't have enough information on, and they want to know more of how to provide the best care possible. And it's quite possible for mental health professionals to become more attuned to the needs of individuals by increasing their knowledge base, specifically around their gender diverse clients. Clients who don't feel safe in a mental health setting are more likely to delay necessary care, or they may not seek care at all, and it becomes quite a strong barrier towards the client-patient relationship. Nearly every, if not every, major mental health organization explicitly supports and advocates for better care for LGBTQ individuals. Just a couple examples from some of the largest or most common ones: the American Psychological Association and the American Psychiatric Association. Both of them call upon people in their societies to increase the competence for transgender and gender variant individuals to provide the best treatment care possible. Aside from what we already mentioned about reducing the delay in seeking necessary care, having a provider who is transgender competent makes it more likely that a patient is going to have reduced symptoms of depression or contemplating or even attempting suicide. Across the country, there are varying levels of how the systemic structures put in place against transgender individuals can affect them. For example, if we just look at the gender change policies on driver's licenses in the different states, there are some of them that do really well, that make it really easy, and they really support people in doing this. And there are other states that make it very onerous to the individual or simply don't allow that at all. This is definitely going to have an impact when you're working with these individuals. Here's a little joke for you that I enjoyed and I thought you might enjoy as well. If we look at how the evolution of gender identity theories have changed over time, when we've seen a shift from what could be best described as suspicion of a variety in gender to really an acceptance and the placing of the patient or the client first and allowing them to explore the space for their natural feelings and their own natural reactions to come out, and working with them in that. There's the case of a young boy that was referred for circumcision, which failed, and so the psychologist decided that he would tell the parents to raise this young boy as a girl instead, because he truly believed that gender could be whatever you told somebody that they were. And so up until the age of 7 or so, the child had not expressed anything in particular to refute this psychologist saying that he was indeed a girl, until the child reached puberty, and then was struggling with a lot of things and said, and essentially brought up this fact that he always felt like he was a boy. And then as his story was told to him, they had told him how about the failed circumcision, how they had raised him as a girl instead. But it sort of refuted the idea that you can just tell someone to be whatever gender you want them to be, and that there is an innate knowledge of each of us of our own gender identity. Naturally, if gender identity is something that cannot be changed and that lives inside of all of us, as we began to understand this better, then it became the natural consequence of this is that many practitioners said, well, hold on, let's allow the child, or let's allow the person themselves to tell us what gender identity they are, rather than us trying to impose something upon them. We had a quote from Diane Ehrensaft earlier when we were talking about how gender identity models have evolved over time. Let's dive a little bit more into what Diane Ehrensaft's gender affirming model looks like. It has these 5 tenets. The first one is that gender variations are normal expressions and they are not disorders. The second one is that gender presentations are diverse and varied across cultures. That means that what we might have in one particular subset of a Western context may not have the same implications or the same norms as someplace in an Eastern context. The third one is that gender likely involves an interweaving of biology, development, socialization, culture, and context. There's no one easy answer to explain why someone chooses to present the way that they do. There's likely a combination of some things that are unchangeable within themselves and how they were raised, their context, their community, things like that. The fourth one is that gender may be fluid and is not binary. This is true both within the individual, that they may have a gender fluid presentation, and it's also true over time that the same individual may have different expressions of gender over time. And the last one is that when pathology is present, it's often related to interpersonal or cultural reactions to a child. That means that it's not the child's gender diversity that's pathological, it's the fact that perhaps their family or their community just can't get to grips with supporting their child in the way that they need to be supported. If we understand that even very young children can know what their gender identity is, we think that it crystallizes in very early childhood. However, depending on the context and the culture that the individual lives in, depending on how much discrimination is present in their area, how accepting or supporting individuals in their life are, they might not be able to come to their own understanding of their gender identity until adolescence, adulthood, even within their very, very later years, such as perhaps in their 70s or 80s or something like this. It all depends on the individual. There's an interweaving of the awareness of one's own gender identity, the exploration of this, how one's own gender expression is modified, and as each of these moves along, it's going to drive each other one in turn. All of these are going to come together and come into a whole entity, identity integration. There is research on how likely it is that a child who expresses that they are a gender other than what they were assigned at birth, how likely is it that they will persist, that is, keep with the same decision of what gender identity they are, or how likely is it that they will desist, that is, they will identify with the sex they were assigned at birth. Ultimately, we think about the longer and stronger that this identification is, the more likely it's going to continue. If they're very, very insistent at a younger age, that's going to predict that it's more likely going to stay. Similarly, if they've been saying this for a very long time, chances are that they're getting pretty clear about what their identity is. Let's talk about some ethical considerations. In order to practice competently working with LGBTQ populations, Here are some things that you should be aware of. You should be knowledgeable of transgender resources, referrals, and processes. You should foster self-acceptance, validation, and coping with painful experiences, recognizing that this is the reality for many people. You should actively seek supervision, consultation, training. Look for those who have quite a bit of experience and ask them to continue helping you improve yourself so that you can provide the best care possible. And the last one is to be aware of the complexities and ongoing nature of the coming out process. It's not a one-stop shop. It's not a one-size-fits-all. There's a lot of nuances of it that can be very tricky, both for the individual as well as the mental health therapist. Some knowledge things that you should be aware of. You should know the distinction between gender identity and sexual orientation, as well as how they do have some interrelated concepts. You should know some various ways of living consistently with one's own gender identity. Know the climate of the community in which you practice. It's going to have a big impact on what sort of experiences the person might be having. And if you already can guess at what some of these experiences might be, it might help you to uncover some of the underlying unspoken things that are happening. And lastly, know the limitations of psychological assessments. Know when they're helpful and when they may not be helpful. Don't just necessarily throw them at every person. Next, we'll move into the role of the behavioral health provider. Clarification and exploration of gender identity are two of the main roles of the behavioral health provider. Essential to the process is the examination of gender identity, gender roles, gender expression, and self-acceptance, and how they all tie together into the client's identity. To best support your clients, you need to have a good working relationship with your client where they are open to provide you sufficient information. This only happens when there's a welcoming, non-judgmental environment for them to be able to do so. Clients should receive prompt and attentive evaluation with connection to medical services as appropriate. Clients should be assisted with coming out on their own pace in their chosen gender. That might be to family, friends, work, and that doesn't mean that you are going to their workplace and saying, hey, I have a client that's transitioning. It means that during your sessions, you can help them talk about what that means to come out at work and what that might look like, what are some of the advantages, the disadvantages, and how do they make that decision. It's also important to remember that due to the high levels of structural discrimination that many transgender people face, they experience higher rates of depression, anxiety, trauma, substance abuse, self-harm, suicidal ideation. And you have to understand that without the resolution of some of these structural factors, there's always going to be some of these risk factors here. And so part of helping the client the best is understanding how to mitigate some of these risk factors. Let's talk about the spectrum of transition. There's a pretty wide range of spectrum of gender identity and gender expression for people. And these that we list here are just some of the examples. Each individual will have their own unique presentation, their own experiences, and their own journey. Clients should feel empowered to be the person that most accurately represents who they are, not who they feel that they have to be for either their family or their community or even for you. Keep in mind that these outside pressures do exist, and some clients may choose not to express themselves in a certain way due to pressures from their family or their community, and that's okay too. Not all clients are going to want some kind of medical interventions, such as hormones or surgery or anything like that. Some may want one or both or neither, and helping support them have access to whichever one is most appropriate for them is going to be the best way to go about it. I think it's important to have a non-judgmental, open dialogue about what their expectations are, what their identity is, what their expression is. If they do choose to undergo some sort of medical treatments such as hormones or surgery, what is the likely outcomes or what are their expected outcomes to ensure that something is going to be realistic? If you have an adult client who comes and is wanting to start on hormones and they're hoping that the hormones are going to change their skeletal structure, for example, that may not be the case. They may not grow taller if their bones have already fused long ago at the end of puberty. It just really depends on the person, and they should be having this discussion as well with the healthcare provider, but opening the door and for them to explore and be able to voice what their hopes are is at least a starting point. Previous negative experiences by either the client or someone that they know may make them fearful about expressing themselves the way they want to. Similar negative experiences could affect the initial parts of your relationship with the client if they've had negative experiences with therapists in the past. Discrimination can also make clients make them feel like they have to quote-unquote pass or non-disclose their gender identity when otherwise it may not be important to them. Talking through what that means to them, what it would mean to be able to or not being able to pass, can be something helpful to talk about. Sometimes with a change in gender expression comes a change in privilege. That could be a positive change in privilege in terms of gaining more privileges than one previous had, or it could be a loss of some privileges that the client used to have. And so for sometimes if they lose privileges, it can be helpful to experience or to talk through what kind of a loss that might be or any grief that they have around that process. If they gain more privileges, how do they feel about the privileges that they now have that they didn't before? Do they feel guilty about this, or what kinds of feelings is that bringing up against them? Let's talk a bit about hormone therapy. First, we'll talk briefly about feminizing hormones, the most common of which is estrogen. Estrogen induces development of particular secondary sex characteristics. Some of the effects of estrogen are reversible, some are semi-reversible, and some are irreversible, that is, permanent. It's helpful for the client to talk to a qualified physician with a background in prescribing these hormones to fully discuss expectations, risks, and benefits. Additionally, there is a risk to fertility with taking these hormones. Sperm banking should be considered or at least discussed prior to initiation of such hormones. Next, we'll talk about masculinizing hormones, the most common of which is testosterone. Testosterone induces its own particular set of secondary sex characteristics, some of which may be familiar and recognizable, like baldness, voice deepening, facial hair growth, and many of these are irreversible after testosterone has been taken. Like estrogen, there is a risk to fertility with the administration of testosterone that may not be reversible. Discussion of cryopreservation should be discussed before testosterone is initiated. For adolescents, an additional hormone may be puberty suppression that prevents them from going through a particular form of unwanted puberty that doesn't align with their gender identity and puts it off for some period of time, either time for there to be a discussion and about expectations, about what they want, or perhaps it's a decision that they came to with their family. Either way, as we've talked about reproductive counseling with the last two types of hormones, it's especially important in adolescents because of the age at which they may be starting it, and because their parents may be required to be a part of this discussion if they are still a minor and not allowed to make some of these discussions. You can take a look at this chart to look at some of the potential risks of feminizing or masculinizing hormones. This should not be considered a tell-all, and again, a discussion should be had with a qualified health professional before any hormones are started. as we talked about with the reproduction, it may cause infertility. However, neither one of these hormones are an effective birth control. People should still continue to use whatever kind of birth control they usually do if that is something that they are planning on wanting to be effective. On an ongoing basis, people receiving hormone therapy will still need risk screening based on the organs that they still have. I'd like to try an activity with you. I often do this activity in person, but since we don't have the chance for that right now, I'd like to engage with you, and I just need a bit of interactivity. Work along with me when I'll be talking on this end, and you can either think in your head or even write something down if you like. I think it might be fun. Privileges are special rights or advantages that are only available to a particular person or group. They not only exist in politics or laws, but also in the social and interpersonal arena. This activity highlights the many ways that gender normativity and larger systems of oppression are institutionalized throughout our culture. It might make you think a little bit more about what privilege you do or don't have. On the next few slides, I'm going to highlight a few different privileges that oftentimes transgender individuals may not have. And for our exercise, I want you to look at these privileges and decide which one of them you would have if you absolutely had to give up the rest. So let's start with this first page. Which one would you choose? Using public restrooms without fear of verbal abuse, physical intimidation, or arrest? Being in public and not worrying about being stared at because of your gender expression? Or receiving medical care, including emergency medical care, without worrying that your medical needs will be viewed as resulting from your gender identity? I'll give you a second to think about which one that you would pick. Keep this in mind as we go through the next slides as well. For our next set, you get to pick one of the following four. Going shopping without fear of being questioned about being in the wrong fitting room. Raising children without worrying about state intervention, without worrying that your kids will be taken away from you. Feeling unthreatened in your interactions with authority figures and police officers. Or having your gender identity recognized and validated by family, neighbors, and colleagues. Which one would you choose? And here's a few more choices. If I'm going too fast, feel free to pause at any point to take a little more time to look at the choices. Which one of these? Traveling without worrying about your safety due to your gender expression or identity? Having essential medical procedures performed and covered by your insurance, no matter how small or how large? Being employed as a teacher without people assuming that you will corrupt their children? Or receiving validation and acceptance from your religious or spiritual community? Which one of these? Here's our last page. Which one of these four? Going to a doctor and having them respond properly to your questions about sexual health? Having new people assume and use your personal pronouns correctly? Going to a social gathering, not worrying about strangers asking about your anatomy, including your genitals? Or having legal documents that accurately represent who you are and how you identify, including being able to get a passport or birth certificate or some of these other documents? It can be a hard decision which one you would pick. How did you decide which privileges were most important for you? Looking back at the few that you decided, how did you pick? And how many of these do you think that you would have wanted if you had the choice? I think for me, that one's an easiest question because I think I would want all of them if I had the choice. Which ones were you unaware that transgender people did not possess? The truth is, many people may not have the choice to pick one of these four They might not have any of these privileges on a given day. So even getting to pick one of these might be something that they haven't experienced. I hope that this brings a new awareness to you when you're thinking about how privilege affects transgender people in their day-to-day lives, and the kinds of privileges that you may have that you may never have even thought about. In the next section, we'll talk about systemic relationships, what might be helpful to know, and what you can do to support these. When one partner in a romantic relationship decides to start transitioning to another gender, it's going to affect both partners. It's going to affect trust about how could you not tell me something like this before. It may affect difficulties with intimacy, as partners may not want the same things touched in the same way as they used to like, or potential rejection. It also involves potential sexual identity shifts, as a previous partner who, for example, might have seen themselves as heterosexual, if your client is now transitioning to another gender, their romantic partner may decide whether they now identify as homosexual or bisexual, and what does that mean that they're in a relationship with someone that's potentially, let's say, of the same gender. Both partners may choose to seek out services to undergo their process, like couples counseling or something like that. There may be many feelings of grief or betrayal of, they may feel like they don't even understand the person anymore, is something that I've heard a lot. So supporting all members of the relationship, not just your client, is key to achieving the best possible outcome. Something to keep in mind is that transgender clients may also be more vulnerable to intimate partner violence, although it's not a given that any couple is going to have partner violence. The family has their own share of the coming out process. They might have a disbelief of how could they have never have known. Family members tend to have known the individual longer than potentially anyone else in their life, and so they may go through their own stages of shock, disbelief, feelings of betrayal. Sometimes there's grief and loss about some specific gendered relationships that exist in our society. For example, people may talk about a father-daughter relationship, and if your client is saying, well, I'm not a father, I'm now a mother, or I'm not a daughter, I'm a son, then other family members may react to that in a particular way. Parents may have had particular expectations that they place upon their children, or a particular way that they're going to have their wedding, or things like this. Even if your client never planned on having a wedding, it doesn't mean that the family members didn't put their own expectations and their own issues onto your client. Family members may struggle with pronouns and name changes, in part because, as I mentioned a minute ago, these may have been people that have known your client longer than anyone else in their entire life. And if your client has used one particular name instead of pronouns for 20, 30, 40 years, it may be very difficult for family members to switch immediately. Consider engaging with a gender-affirming couple or family therapist for assistance if needed. In the community, transitioning clients may need assistance connecting with other transgender services, such as support groups, doctors, attorneys, and so on. You may know some of these resources that you're able to give them or point them in the right direction. Transitioning in a professional environment is another layer of difficulty for many transgender clients. Transitioning clients may need or request assistance informing their employers or their educational institutions. There is frequently discrimination that is reported from people that are transitioning. They may fear for their loss of job. In Colorado, it's illegal to fire somebody simply because of their sexual orientation or gender identity. However, that doesn't mean that there are many microaggressions or even overt discrimination that occurs that can be very difficult to prove in court. Discrimination can have a long-lasting impact on transitioning clients. Being familiar with the laws in your state, in addition to the overall gestalt cultures and behaviors in your community, may help you be more equipped to deal with these things when they're coming up. Next, we'll talk about attributes of a transgender inclusive provider and knowing when to refer. Not every patient is suitable for every provider, so it can be helpful to think, is this the right fit? What sets inclusive providers apart from non-inclusive providers? We mentioned at the beginning of this session how competence is not the same thing as confidence. In order to be an LGBTQ competent provider, there's much more than just being okay that someone is transgender. A transgender competent provider has an extensive knowledge about transgender related health needs. They have a high comfort level with clients who identify as transgender. They have specific skill set to identify transgender specific needs, including medical needs. Even if you are not a medical provider per se, they know where to find these people. They have the ability to provide appropriate care or to refer when needed. They understand models of sexual orientation and gender identity that they need to apply with their clients. If you're working with transgender clients, it's imperative to have a network of trusted healthcare professionals. Many transgender clients will inquire about medical needs, not all, but it's important to know where to refer when you need to. If the therapists are not trained in gender affirming therapy, it's possible that there actually may be harm done to the clients and their families. That's why it's so important to educate yourself on these topics. Be familiar with the resources in your area, whether it's a community center, the Center on Colfax, other therapists or counselors that work with transgender clients, family or marriage counselors, and so on. That concludes this session of Basic Affirming Information for LGBTQ Therapists, with a focus on transgender health. To find out where you can learn more, visit the Center on Colfax website at www.lgbtqcolorado.org. You can also check out these websites from professional organizations to further your education. This presentation is dedicated to the following people, as well as many countless thousands of LGBTQ activists both now and throughout history. Special thanks and recognition to the Center on Colfax and the members of the Mental Health Committee who helped put together the initial presentation that made all this possible.